Good evening. Have you ever had pain that starts up in your neck, radiates down in the shoulder blade, down throughout your arm, and the pain is so bad that it doesn't let up and it begins to affect everything that you do day in and day out, starts to affect your sleep, starts to affect your personality? If that's you, then you're in the right place. Tonight, we're going to talk about a patient I recently treated that had those symptoms, and we're going to talk about treatment options. Welcome back, iMove TelePT community. So glad that you all are here tonight for another edition of Thursday Tell Me Why Thursdays. As you know, Thursdays are a day that we talk about a patient that I've treated before, and we talk about their injury, and we attempt to figure out the why behind the injury, because pretty good chance that this patient is very similar to someone that you know that has the same types of symptoms. Good evening, I'm Dr. Michael Gorman. I am fellowship trained physical therapist, and I'm the owner and founder of iMove TelePT. So glad you all are here again in our community. This, as always, I am very grateful for you all that take time to hear what I have to say. I always try to share good content to educate our community. You know me, I definitely like to make this. I like to make this interactive. So please give me a thumbs up, wow sign, give me a heart, whatever helps. But please let me know what your thoughts are. Interact with me as always. That's what makes these so awesome. First question that I have for you, and I would love for you to respond, is true or false? True or false? Have you ever had, well, not really true or false, not a true or false question, but it's a yes or no question, not true or false. So yes or no, have you ever had a pinched nerve in your neck? And if the answer is yes, so you tell me yes or no. If the answer is yes, I want you to tell me what that felt like, because I want to share that with some of the people that are on this call. I've had a pinched nerve. Didn't per se shoot down my arm, but shot down right into my shoulder blade and caused me to have a lot of muscle spasm around that area. So please let me know your story. And if you've had pain, let me know and just kind of describe that pain for me, and I'll share. Okay. So tonight we're going to talk about the neck, which is called the cervical spine as well. I'm going to give you guys a lot of pictures, and I've got some pictures of some exercises to help. But as always, I like to briefly go into the anatomy of the area so you all can begin to understand. Hey, Tom. Hey, Sharon. Sharon said no, she's never had pinched nerve. My dad said yes, and Ron's had pain. So yes, it's very, very, very painful. So your amazing neck, it's only amazing when it works. So we know that it's a very complex area. In fact, shortly I'm going to tell you how many miles of nerves there are in the body. That's another good question. I want you to respond. Take a guess. Take a guess as to how many miles of nerves you think you have in your body. It's a pretty amazing number. So I'll share that with you shortly. All right, this is a picture of your back. You see the back of the head, you see your shoulder blade area and the muscles that overlay this. I wanted to show this picture because what you don't see is in the neck area, if we took those top muscle layers off, there'd be several other layers of muscles underneath that. Very, very complex. If we then take the muscles away, okay, so we've stripped the muscle layers away, and you'll see all these nerves. Now, I'm not going to tell you yet how many miles of nerves are in the body, but you see all these nerves, and those nerves are what connect your brain and your spinal cord out to the muscles themselves, out to your joints, to get everything to function. So, I'm going to have a Facebook Live about this soon, but a muscle is actually dumb. It depends upon these signals that are transmitting from the brain, spinal cord, and down out into your nerves. So if we have a pinched nerve in your neck, well, guess what? Wherever that nerve goes to, you're going to have pain. You could have pain, you could have numbness, you could have tingling, all kinds of things. That's why I wanted to know if you've experienced pinched nerve before. I want to know what that feels like. So Ron, you said yes, pain, but I want to know a little bit more about what that pain felt like. Was it burning? Was it numbness? Was it tingling? What was it? Okay. Next, we're going to talk about causes of pinched nerves. Now, there's several. I'm just going to hit on just a couple right here. So please know that there's many others besides this. But these are the three really two that form one. But these are the ones that I have dealt with my whole career. And we're going to show you some pictures of that. But we're talking about a bulging / herniated / aged disc. We're going to talk about joint arthritis, and both of these issues, whether it's a disc issue or arthritis, they cause what's called stenosis. Okay, they cause what's called stenosis. Brian's on. Thank you for joining tonight, Brian. I appreciate that. I definitely appreciate that. Thank you for joining the community. All right, so let's show you this picture right here. And this just shows the area where the nerves, I know there's a bunch of nerves here. I know there's a lot going on there, but this shows where that arrow, where that pinpoint of that arrow is, that shows where the nerves come out. Okay? So what stenosis is a narrowing of the canal. Okay, and a canal can either be in the center, caused by a disc that pushes back, or a stenosis could be where this arrow is drawn to, where the hole or the space where the nerve comes through gets narrow. First thing, right here, I know this is kind of a crazy picture, but what we're looking at right here is the left side of someone's neck with all the muscles and everything taken away. So you're essentially seeing, right here, one of the green arrows is going to a disc, and the other is going to where there's a pinched nerve. So you've got the red part of the nerve, and that's the nerve that's getting pinched. What happens is that disc over time can begin to bulge out, or you get arthritis in the joints of the spine themselves, and that nerve gets pinched out. And wherever that nerve travels to, like I talked about earlier, wherever that nerve travels out to, you will you'll experience symptoms, all kinds of symptoms. This next picture right here, this is actually, guys, this here we're looking straight at a spine. So you can see what the arrow is showing is that's where your disc sits in there. And I just wanted to show you this. I know there's a lot going on here, but let's kind of talk through this. What's going on here is that you see that the arrow is pointing where that disc is, but as all of us age, a normal part of aging is that the disc, which is made of cartilage, the disc begins to flatten down. So over time, it begins to degenerate, and that just means that disc begins to flatten down. But what happens is you'll see the little, if you go right to the right of the arrow, you'll see where the nerve is being pinched off again. and where that little red part of that nerve is, right to the right of the arrow. And that is because the disc itself has narrowed down. And so that nerve coming out from your spinal cord all of a sudden has less room to breathe. Okay, less room to breathe. I'm going to go back and see if anyone has taken a guess as to how many miles of nerves there are in your body. Come on, Sharon, take a guess. Tom, take a guess. Brian and my dad, Ron, please take a guess as to how many miles you think there are of nerves in the body. Okay. Okay. So again, I want you guys to tell me how many miles of these nerves in your body. I'm going to show the picture here real quick, but I want you guys to take a guess. Sometimes my chat stream is a little bit slower than what's really coming through. So I'm going to show you. I'm going to show you this great picture and take a guess. There's 37 miles of nerves that are coursing through your body. 37 miles, that's crazy. That's crazy to think that for the most part, most of us live day in and day out, most of us essentially pain-free. So that just shows you how amazing that the human body is. Absolutely amazing how the human body is, and how for the most part, it works great. But again, anything that narrows that space where the nerve comes through in your neck, we're specifically talking about neck here, anything that narrows down can very well cause a pinched nerve. And when a nerve gets pinched, you have inflammation and you have pain. So hopefully that understands, but that's really, those are two or three main components of the why behind why one can get a pinched nerve. Your disc, your arthritis, and both of those can lead to something called stenosis. Okay, so now that I've told you a little bit about what causes this, I want to talk more about treatment. Let's talk about treatment here. First of all, we know there's surgery. And I will tell you that surgery is very much a last-ditch option. Anyone with neck pain needs to make surgery, and any qualified surgeon will tell you that same thing. Surgery is really the last option. Now, if you're telling me that your arm is totally numb and there's no function in the arm, that may be a different story. But if you're having pain in the neck that's going down your arm, that's not something that requires surgery. So that's one option, and that is, again, surgery, last ditch option for sure. So next thing are injections. Everyone's heard of steroid injections, and there is a time and a place for steroid injections. There definitely is a time and a place for steroid injections. So if you have a pinched nerve in your neck and the inflammation, the swelling is not going down, then I definitely think that getting an injection is an option, okay? But you have to understand that, again, any qualified pain management doctor will tell you the injection is good, but the injection is not a cure, because if you have a nerve, if you've got a nerve that's swollen and they inject a steroid into that area, well, yeah, guess what? It's going to cause the nerve to shrink just a bit, or perhaps that disc to shrink just a bit. So voila, less swelling, and you'll have you'll have less pain. However, once the effects of the steroid have worn off, unless you've combined it with other treatments such as physical therapy, guess what, guys? The problem is probably going to come back. Probably going to come back. I don't have a number to give you, but from my experience, I'm going to probably say I don't know, maybe less than 20% of the people that get an injection, the problem's gone. It typically will come back, and they typically will do steroids. They can do really up to 3 a year in a specific area. And so sometimes they'll do 3, and sometimes you need 3, and that's great. All right, couple guesses from earlier. Some of the streams are coming through. I want to take a break for just a sec. Sharon says she doesn't know where her last nerve is. That's probably because she's married to me. Brian said 26.2 miles. He obviously is thinking about he's thinking about how many miles he ran last night. And Tom correctly guessed 37 miles. Now, I don't know, Tom, was that after I said it or before? Yeah, but even Brian said, did you cheat, Tom? Did you cheat, Tom? Tom said he guessed, but that's a pretty good guess. But again, think about that, 37 miles, that's crazy. All right, getting back to our treatment. So we've talked about surgery, last ditch option. We don't want to go there unless you absolutely have to. Absolutely have to. Sometimes you have to, but hopefully not. Injections oftentimes are helpful. They decrease inflammation, which can decrease swelling, which will decrease pain. Most times your symptoms come back unless it's combined with other treatment. So combining it with something called orthopedic physical therapy intervention, orthopedic manual therapy intervention treatment is great. So now I want to just talk through a couple of things that I did, and you might say, well, Mike, you're doing telehealth now. How in the heck are you doing manual therapy? Well, that's very, very good. That's a very good question. But even when I worked in the clinic, there were so many times that I would bring a spouse back or bring a friend of a patient back and teach them some real gentle manual things to do. So in the iMove TelePT platform, we have created extensive amounts of patient educational videos that I can share with my patients to allow their family, their friend, their assistant, whatever, to safely help them do some manual techniques. Because you're right, I'm here and you're there. I can't get my hands in there, but it works beautifully. So manual therapy is combining soft tissue techniques and joint mobilization techniques along with specific exercise and education. So I instructed this patient's spouse how to do appropriate and gentle and very safe manual therapy techniques to decrease some of the muscle spasm. I told you guys earlier, wherever that muscle or wherever that nerve goes to, you very easily can have muscle spasms and it begins to contract. So doing some soft tissue techniques to the area can be oh so helpful to decrease some of that tightness and pain. I taught the spouse how to do some gentle manual traction to help to unload that area, to take a little bit of pressure off of this nerve that's being compressed. It's not a cure-all, end-all, be-all, but it's a component that definitely helps. Okay. Next, we talked about with this patient. We talked about posture, and I did a Facebook Live. I forget when. Well, sometime in April. That's when it is, because that's when I started this, April 1st. We talked a lot about posture because the influence of one's posture greatly influences that little bitty nerve that's going out of that tiny little hole. So the forward head posture, as you see here in this picture, the forward head posture will definitely impact that area. Nice tall posture, you keep in that space where that little nerve goes through as wide open as you can. As the head begins to drift forward, as you're looking at your iPhone, your iPad, you're sitting at your desk reading a book and your head's forward, all those things will begin to, over time, will begin to narrow that space space where that nerve comes through. So anyway, posture was huge, and as a physical therapist, education is a big part of what we all do, and that's the thing that's going to carry on with people. Also, we did some exercise as well. So I'm going to show you a couple pictures of me actually performing the exercise, so we respect HIPAA compliance. This is a picture of me doing an exercise where I have the TheraPulley, which Yusuf talked about last week. I've got the head strap attached to me, okay? And I'm simply walking away from that door. So I've got the pulley is attached to the back of the head strap, and I'm walking away. And I'm working on some strengthening of the muscles in the front of my neck, giving stability, because when we have pain, one of the major things that happens when we have pain is that we start losing strength, and that happens in a hurry. So we have to restore that. We have to restore that strength. That's one exercise. The next exercise looks very similar, but what we're doing is I'm walking away from that pulley. So now I'm working the muscles that are in the back of my neck, okay? Very safe, very easy. Weight-wise, I've got a pound in the bag, because when you're doing exercise for a neck, the weights of the exercise have to be light. We're not trying to give you an Arnold Schwarzenegger and his steroid prime neck. We're trying to give you a very functional, stable neck that can do many different things day in and day out. So again, be really careful if you're using any type of heavy weight with the neck exercises. That's really not what it's about. And make sure that if you are exercising and it hurts, it brings on your symptoms, put a kibosh on it. Tom, is that that's a word you probably hear up in Chicago a lot? Kibosh. Sounds like a Chicago-ish word. Anyway, I love Chicago. Absolutely love Chicago. Went up there last year, took my daughter up there, and spent way too much money, ate way too much food, but I digress. Back to the back to the show here. So this is another exercise that we did. So when we are working with a neck, we look at the whole spine. And oftentimes, when the neck is involved, what happens is the upper part of your back. So the middle part of your back is called your thoracic spine. So the upper thoracic spine typically gets stiff. That happens to nearly all of us. And so if that part of your upper back is stiff, well, guess what? More stress gets placed on your neck. So to unload the neck a little bit, take a little pressure off the neck, why don't we do this simple exercise where we're self-mobilizing over the foam roller, okay? And we're just trying to mobilize the upper thoracic spine. So that's really a great exercise. Great exercise there. All right, so how is this patient doing? This patient that I've been seeing now for 2 weeks, we have about a 25% reduction in pain symptoms, and she is sleeping better and moving better. So everything's on the right track. We're not out of the woods yet by any means, but you know, we're at least on the right track. Tom says on kibosh, yes, kibosh, but I think it's maybe in my mind I misspelled it. But anyway, thank you, Tom, for clearing me up on kibosh. Thank you so much. I can always count on you to clear me up. So let me know if there's any questions about that, but hopefully, again, the why. If we can understand the why behind an injury, we are a little bit more empowered. We're a little bit more in control of our symptoms. So now you know the why. Again, there's other reasons why, but 2 or 3 common reasons of the why we talked about. It was the disc issue, either a bulging disc, herniated disc, an aged disc, or arthritis of the joint, but both of those will cause some kind of stenosis. And when you have that stenosis, the nerve gets a little bit pinched off, and it could cause pain, it could cause numbness, it could cause muscle weakness, all those. So in our physical therapy treatment plan, we addressed all of those to give this patient a little bit better quality of life with less pain. All right, so thank you all for being here. Please, please, please join me next Monday, first Monday of May. Congratulations, we made it through April. Hopefully May, with the COVID pandemic, hopefully we all get back into life slowly, but hopefully things will start coming back in May. But this has been a fantastic April. I want to just thank you all for being here. But anyway, Monday, it's Movement Monday, and guess what we're going to talk about? The jaw. What? Why are you talking about the jaw? That's crazy. The jaw, you go to a dentist for the jaw. Well, guess what? A physical therapist does a great job, if they're trained correctly, does a great job in treatment of the jaw, which is called the temporomandibular joint. So we're going to be talking about that on Monday, and I look forward to all of you coming back on Monday and being a part of that. We'll also have our Monday motivational quote. If there's one that you really like and you want me to say, please email it over to me. I'm Gorman at iMoveTelept.com. So again, thank you all for being here. I'm very grateful, very, very grateful for you being here. Please share this. Please share this content with friends and family, and please invite them to our broadcast. It would mean so much to me, so much to me. But have a great rest of your day. It's Thursday, so stay home and stay strong, and please have a safe weekend. Take care.